and I am the Director of Education with NeedyMeds. And today, hopefully, I'll be able to teach you how you can help your patients or your clients save on their healthcare expenses through NeedyMeds. So before I dive into the presentation, I want to go over just a few sort of housekeeping tips. You can certainly feel free to ask any questions you may have throughout the presentation by typing them in the questions section of your GoToWebinar control panel. Just know that I will reserve answering all questions until the end. If for some reason I don't get a chance to answer your specific question, I will follow up with you after the webinar by tomorrow morning at the latest. Also, of course, I'll provide my contact information at the end, as well as the contact information for NeedyMeds in general. And just a heads up that today's presentation is being recorded, so we'll be able to convert it into a video and post it onto our YouTube channel. So with that, let's go ahead and get started. For those of you that are not familiar with NeedyMeds, there's a snapshot of our homepage. And I always put that up because really the NeedyMeds website and the call center, those are the faces of our organization. So NeedyMeds is a national nonprofit. We were founded 20 years ago. We celebrated our 20th anniversary in 2017 by a retired family physician, Dr. Richard Sagel. And Rich is still our president. Basically, when Rich was a practicing family physician, he noticed that many of his patients couldn't afford their medications, and he worked to try and find a solution to that. And so that's how NeedyMeds was born. To be clear, NeedyMeds is an informational resource. Through our website and our toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses, including but certainly not limited to medications. This slide gives you a sampling of some of NeedyMeds' most popular destinations on our website. And what I'm going to do is I'm going to transition out of this slide to the NeedyMeds website so I can show you sort of what our website looks like, the breadth of the information that is covered there, and how you can hopefully easily negotiate it when you are on our website. And then we'll move into how you can directly also, once you learn about NeedyMeds, how you can directly help your patients and your clients use us as a resource to save on their healthcare needs. And when I say that, I'm talking about everybody. A lot of people may not turn to NeedyMeds because they think that we only help people that do not have insurance. And that's not the case. There are a lot of programs that help people that already have insurance, but maybe it doesn't cover this particular medication or need. And many of people are operating out there in a term that you may have heard before, being functionally, or I think I'm getting this right, functionally insured. Essentially what I'm getting at is that people have some sort of health insurance and drug coverage, but certainly not comprehensive enough to cover all their needs. And hopefully that's where NeedyMeds can come in. So anyway, here's a snapshot of our most popular destinations on our website. Another little disclaimer, this presentation is focusing on our website, but I want to stress that everything I'm showing you and everything I'm going to explain, you can also get this assistance or direct people to get this assistance by calling our toll-free helpline. And you'll see that on our website, and it will be, of course, listed at the end of our presentation. But you can direct people directly to our expert call center counselors, and we also do have Spanish-speaking counselors. So anyway, this 8 or so programs that are listed on this slide called cost savings resources, again, don't cover all of the resources we have, but it certainly shows you some of the most effective and popular ones. And I just got a question coming in from the audience asking whether or not I can email the slides after the presentation, and I absolutely can. And one of the other things I'm going to do, if you'll bear with me, at the end of the presentation, I'll hopefully be able to upload it into the handout section so you can download it immediately. Thanks for that reminder. So anyway, on the screen now are some of the most popular programs, including patient assistance programs, diagnosis-based assistance program, our clinics database, coupons and rebates, diagnosis-based assistance programs, the newly added medical transportation category, retreats, camps, and educational scholarships, as well as government programs. So most importantly, how do you find all of this information on our website? So bear with me while I transition out of the PowerPoint into the NeedyMeds website so I can hopefully show you exactly how to do that. So we're on the live NeedyMeds website, and as you can see at the top, there's a bunch of there's a navigation bar that can help you do just that, navigate through the NeedyMeds website. All of the cost savings programs for healthcare will be found under the Patient Savings tab, which is where I'm going to spend the first little bit of this webinar. So one of the things that we're so proud of here at NeedyMeds is simply the breadth of the programming that we have on our website. One of the downsides is that can be overwhelming. If you're not already familiar with what NeedyMeds is and what we do, it can be a little bit overwhelming to come to this website and click on that Patient Savings tab. So now that we're here, and now that you know what NeedyMeds is and what we do, I'm going to show you how to find what you need on our website. So one of the very first places that you're going to look if your client or patient needs help affording a prescription medication is you're going to look for something called a prescription assistance program. Prescription assistance programs can be found right on the left-hand side at the top. Click on that brand name drugs hyperlink. Prescription assistance programs are programs that are supported by pharmaceutical companies that offer free, sometimes deeply discounted, but mostly free name brand medications to those who qualify. I didn't know what these prescription assistance programs or PAPs were before I worked at NeedyMeds, so I'll tell you how I finally understood it, and it's really simple. If you're watching TV and you see a commercial for a name brand medication, and at the end of that commercial, very quickly the narrator says, or in fine print at the bottom of the screen, it'll say something like, if you can't afford your medication, AstraZeneca may be able to help. Now, that's an example of a prescription assistance program, and there are hundreds available out there. So what we've done is we've compiled a database to find a program to help a person afford their name brand medication. Again, I want to stress, are there going to be programs that somebody does not qualify for? Because every program does have different eligibility requirements. That maybe they don't qualify because they have insurance? Certainly, but it's not always the case. So it's certainly worth checking out. Now, when I click on that brand name drugs hyperlink, the first thing that pops up are a bunch of icons. These icons let you know what assistance or information is available about that drug. So, for example, this icon, indicates that there is a prescription assistance program. Sometimes it's part of a $4 generic discount drug program. Sometimes there's a coupon available. And this little column on the right, support pages and drug videos, that lets you know additional information about the medication. So let's say I'm looking for help with a name brand drug medication, Lipitor. Well, I simply choose the letter L in the A to Z index, and then I scroll all the way down through the list of medications, hopefully to find Lipitor. Lipitor is actually listed more than once. That's because it's available in a different formulation. So I'm going to go ahead and click on the top hyperlink. There are those icons again. The left icon indicates that there is at least one prescription assistance program available. When I click on that, in fact, as indicated at the top, you see that language program 1 of 3 in the blue bar? That means exactly that there are currently 3 prescription assistance programs available for Lipitor. When there is more than one, the programs with the most assistance will be listed at the top, and the least assistance will be listed at the bottom. I'm going to make this screen a bit smaller. Don't worry about seeing the text just now, because what I want you to just get a snapshot of is all of the information that's listed on your screen now. And those prescription assistance programs will all be listed exactly the same way, and they'll be differentiated with that blue bar where now it says program 2 of 3, and as I scroll down, program 3 of 3. Now, as we had talked about in the beginning, I certainly want to point out here's the eligibility requirements for this program, which is sponsored by Pfizer. And in this case, the person must be uninsured. But as I scroll up and I look at the different eligibility requirements, it looks like often in other times it's determined on a case-by-case basis. Now I'm going to scroll up to the one at the top. And in fact, you can see in the eligibility requirements section here, this person may have insurance to qualify. So let me take a moment to point something out. We have our mission statement here at NeedyMeds to educate and empower those seeking affordable health care. But our vision statement is affordable health care for all. Unfortunately, it seems we're getting further and further away from that in our country. So when somebody turns to NeedyMeds, and again, regardless of whether or not they have insurance, our first goal is to connect them to a specific program that will work for them. And we'll always start that search by looking for the ones that will offer the most savings, which is always, again, prescription assistance programs, which is why that's what I'm kicking this webinar off with. And once you look for a prescription assistance program and you're lucky enough to find that there is one for the medication that you need, all of the information is right now on your screen. So in other words, we're not going to just list a program and an 800 number and say good luck and send you along. We're going to let you know or your clients know whether or not they are eligible for their program right here on the NeedyMeds website, or again, our expert call center counselors will let you know. So I'm just going to walk you through really quickly the information you see on your screen. At the top, you'll always find the name and the contact information for the supporting organization. That's because if you have any questions about the organization, about the program, you're going to want to reach out to the sponsoring organization, which is in this case, RX Outreach Medications, as opposed to NeedyMeds. Pretty much always in the programs and applications section, you'll find a hyperlink that will allow you to complete and print out the application right from your computer. If that's not available, just more instructions will be provided. Next, you'll find the eligibility requirements section. And as I had mentioned very briefly in the beginning, eligibility requirements will vary from program to program, but they're almost always based on whether or not somebody has insurance and what their annual income is. And because asking about the annual income as part of the eligibility requirements is so common, we put together a quick federal poverty level calculator right there so you can figure out whether or not your client or patient is eligible. I want to take a moment also to say one of the things I'm hoping to achieve with this webinar is that even if you or your staff don't have the time to sit down and walk somebody through the website or find what they need on their website, you can give them our website address, or you can direct them to our expert counselors at 1-800-503-6897. I do understand that some of the audience may not, as I said, be sitting down and walking your clients or patients through this, but I thought it was important that you simply got a quick understanding of the breadth of the resources that we can hopefully help them with. Under the Patient Savings tab, another section I want to point out before we move on to other cost savings options is our section for help with prescription assistance applications, and that's exactly what it sounds like. Let's say you or your client were lucky enough to find a prescription assistance program that worked for the medication that they're on, and they need help filling out the application. You can absolutely refer them to a free, or sometimes they charge a nominal fee, a location in your area that will hopefully help the client fill out that prescription assistance application program, which sometimes can be a little bit complicated. So I'm going to move on now and point out some of the other cost savings programs that were on that first slide. Under the prescription assistance section, you'll also see a hyperlink for the $4 generic drug discount program. And this is exactly what it sounds like. This is a directory of all discount programs for generic medications available at major retailers. Now, a lot of the NeedyMeds databases, you can search a number of ways. You can search specifically for a drug or for a store in your area, but you can also do broader searches. So I'm just going to choose the state of Florida so you can see what the results yield. In fact, there are currently 16 $4 generic discount drug programs that are supported by pharmacies in Florida. And you can see a lot of the national major chains are included, such as Costco or CVS, but there's also smaller or regional chains that also participate, such as Good Neighbor Pharmacy, Harris Teeter, or a location called Harvey's that I'm not familiar with, being in the Northeast. The middle, you'll find the program name, and the far right, you'll find the name of the program, the details of the program. Now, I want to point out, although we call this the $4 generic discount drug program, most will range in price from $4 to up to $15. And I want to show you that we have that actually written on our website. We never want to be misleading, and we want to be transparent as possible. So again, although it's called the $4 generic discount drug program, most will range from $4 to $15 to a 30, 60, or 90-day supply. So this is a great option for somebody that needs help affording their generic medication. Moving on, another really popular destination on our website is the free, low-cost, or sliding scales clinics database. Now, this database is so large and so popular that we actually have it broken down into 4 sections. We used to only have it broken down between medical and dental clinics, but now it's broken down into also mental health and substance addiction clinics. And these are all set up similarly. So for the points of this webinar, I'm just going to click on the medical clinics hyperlink. And as you can see, I wasn't joking around when I said it's a pretty large database. We have just under 16,000 free, low-cost, and sliding scale medical clinics throughout the country. And these are really great option for somebody that, let's say that they're lacking a primary care physician, they need something affordable that's close to home. This is really helpful. And because this database is so robust, I'm just going to do a quick zip code search so you can see what the results yield. So just within 10 miles of zip code 23223, there are 21 free low-cost or sliding scale clinics. And the columns on your screen, hopefully you'll agree, will give you all the information you need, including the name of the clinic, the contact information, and a website if available, the eligibility, meaning who can be treated at the clinic, and the fees. How much will they charge you to be seen there? Is it free? Is it based on a sliding scale? And the right-hand column tells you the details, meaning what services they provide and the hours of operation. Although we pride ourselves on the information being accurate and up to date, we always recommend getting in touch with the clinic to make sure the hours are open when you plan on heading there, and to also confirm what the fee will be or anything else that you feel is really important. One quick thing I wanted to point out, if you wanted to share this list with a client or patient, you can print all, choose that option, and it'll do just that. It'll print all 21 of these clinics. Or you can choose by clicking the box on the left, only those you think your client or patient will be interested in, and then choose the print instead of the print all option. And it'll do just that. It'll generate and print a list of only those you think will be helpful. Another important database under the Patient Savings tab is the Coupons and Rebates database. This is where you can find prescriptions and over-the-counter medications or supplies for which there is a discount, a free sample, a rebate, a trial offer. That will all be listed here. And in the coupons database, you can search a number of ways. You can search by the brand name or the product name, but you can also search by category, which in this case means diagnosis or field of care. So I'll show you what I mean. Let's say we're looking for help affording blood pressure related healthcare expenses? Well, there are those icons again, meaning that not only will you be able to find out if there's a coupon available, but it'll let you also know whether or not there is another cost savings program available or more information about that drug. And as you scroll down, I'm going to make the screen a little bit smaller. As you scroll down, you could get a quick glance about a quick glance showing you how the coupons and rebates database is set up. And they're all set up the same. They'll have the expiration, the last date it was updated. They'll have a sentence or statement about the coupon. And we actually just changed it. There used to be just a paragraph of information, and people found that really confusing, as would I. So we simplified it by putting in the bullet points, which are the same in every drug that's listed. We also put a hyperlink to the manufacturer's offer for more information, and we also put a handy way to request the NeedyMeds drug discount card. It could be text, emails, or printed out, and we'll get to that a little bit later on because that's going to be something that's hopefully you will find will really help the patients or clients that you serve. Now, I mentioned the coupons and rebates. You can search for help by category, which means diagnosis. And you can also search for diagnosis-based assistance in the center section of the Patient Savings tab under the aptly named Diagnosis-Based Assistance Programs. Like the other databases, you can search a number of ways. I would say program name is the least common. Unless you're in the medical industry, you're probably not familiar with a program that exists. But if you are, you can absolutely look for it there. And certainly, I can't stress this enough, if there is a program that you're aware of that we're not, please share that with us, and we would be more than happy to update our website immediately. You can also search geographically, meaning by what programs are available in your state, meaning you have to live in that state to be eligible, or nationwide, meaning regardless of which one of the states you live in, you can still apply. And you can search, of course, by diagnosis. Now, this is a large database, so there's that easy A to Z index again. So I'm going to go ahead and search on D for diabetes. I always use diabetes as an example because diabetes is a great example of not only a very common diagnosis in our country, but a diagnosis that requires often a lot of out-of-pocket expense. Because often diabetics don't just need medications, they need assistive technology, testing supplies, syringes. So let me just, as you can see, it's a large diagnosis field, so it's broken down into a number of subcategories, but I'm just going to go ahead and choose the general hyperlink for diabetes. There are currently 62 diagnosis-based assistance programs for diabetics. And like the other databases, hopefully you'll agree that the snapshot of information on your screen is all the information you need. The far left is the program name and a hyperlink if one is available, followed by the summary. And the two far columns are probably the most important. Services provide lets you know exactly what assistance that program will be able to provide the patient. And as you can see, they do vary. A lot of times they offer medical supplies, but they do vary. For example, this one offers durable medical equipment and assistive technology. This one offers help affording respite care. And this one will hopefully help you get a service animal if need be. The area of service on the right-hand side lets you know where you need to reside in our country to be eligible. And the right-hand side will always have the national programs listed first, and then the state programs listed underneath that alphabetically. One thing I want to point out about areas of service or residency requirements, you'll find residency requirements in a lot of the eligibility sections on the prescription assistance programs, and areas of service, meaning where the person lives. I want to stress that a lot of times it doesn't, what they're referring to when they refer to residency is simply where the person either currently lives or where they're currently being treated. So if you work if you work with an undocumented population, please do turn to NeedyMeds to see if there are services that we can help support that population. Now, a couple of other things I want to point out. I'm not going to spend too much time here because, sorry guys, I made that a little bit too big. I'm not going to spend too much time here under the Patient Savings tab because the goal of this webinar is just to give you a sense of where to find what you need and what is available. Just going to point a couple of other things out. If you have a client or patient that's been newly diagnosed, our diagnosis information pages are a great destination. They provide a really concise and up-to-date description of what the diagnosis is, reputable resources, and what makes our diagnosis information pages different from other pages available on the internet is we also keep a running list of up-to-date medications that are commonly used in the treatment of that diagnosis. And as you can see, each of those drugs are hyperlinked because it'll automatically search to see whether or not there is a prescription assistance program or other cost savings program available. A newly added section, I always say newly, I mean literally in the last few weeks, due to the need and the request we were getting from our users, we added an entire section dedicated to medical transportation. And it's broken down in a couple of ways. Transportation services, meaning that maybe you need an ambulance or an assistive van that accommodates a wheelchair, and travel expenses, which usually means reimbursement for taking public transportation or a taxi. And this is really helpful. And again, you can search by the least common program name. You can search in your area, or like the other databases, you can also search by diagnosis. Now, if you're looking for assistance for diagnosis support, we also have entire databases dedicated to camps, retreats, and educational scholarships. And that means exactly that. The retreats, camps, and recreational programs, as well as the educational educational scholarships, offer programs for people of all ages at all types of the year that are living with a specific diagnosis. Very candidly, I don't think many people come to NeedyMeds looking for an educational scholarship, but since we found the information, we figured why not share it. If you work for a senior population, the government section is a really helpful location because it lets you know all the state-sponsored programs, but also Medicare information, Medicaid sites, and all of the information that would certainly benefit population, all located in one section on our website. Now what I'm going to do at this point, hopefully I gave you a snapshot of some of the cost savings programs. My goal now is to transition out of the website back to the PowerPoint so I can talk to you about the NeedyMeds drug discount card, how that will help you, and also talk to you about other ways specifically you can help the patients and clients you serve. Just bear with me. And I want to encourage that I do see some questions coming in, so don't hesitate to start typing in the questions that you may have, and I'll be happy to answer them at the end of the webinar if I don't get to them over the rest of the presentation. So let's talk about the NeedyMeds drug discount card. As you can see on this slide, the NeedyMeds drug discount cards can save users up to 80% off of the cash price of prescription medications, over-the-counter medications and supplies as long as they're written as prescriptions, and even pet prescriptions if they're picked up at the People Pharmacy. If anybody's interested in learning more about that, I did put together a quick, less than 10-minute video that will tell you all about that. So if any of the audience today has a dog at home like me who's slowly but surely bankrupting you, this might be a great option for you. So I always say, actually, when I'm talking about the drug discount card, that users can save between 0 and 80%. And the reason I say that is because we absolutely can't guarantee that the drug you need assistance paying for is going to be afforded a discount. I can tell you that although the NeedyMeds drug discount card is anonymous, which means we have no idea who is using the card, we can tell the number of times the card was used and the dollar amount of savings. And our statistics show that the user is afforded a discount 85% of the times the card is presented. So let's talk about who can use the NeedyMeds drug discount card. The answer is anyone. Here's the rule. It can't be combined with insurance. So if you do not have insurance, or your clients or patients don't have insurance, or they don't have drug coverage, they can use the NeedyMeds drug discount card anytime. And again, it's free and anonymous. If you have insurance, you may choose to use the card instead. Somebody may choose to pay for a medication out of pocket, maybe because that medication, that specific medication, is not covered under insurance. Maybe they find themselves in a coverage gap. Maybe they have a high copayment or high deductible. So it's a great backup to have in your wallet, in your pocket, or on your phone. Of course, I'm going to transition to show you where to get drug discount cards and how you can use some tools to maximize those savings on the NeedyMeds website. So bear with me while we transition back to the NeedyMeds website, and I can show you where to get your NeedyMeds drug discount card, or more importantly, where to direct people to get them. So there's a number of places on the website where you can find a hyperlink for the NeedyMeds drug discount card, but they'll all bring you to the same place. That box on the left-hand side with that red arrow, get your NeedyMeds drug discount card, it'll bring you all here. So here's how you can do it. You can print out this downloadable PDF and have your clients just clip out the card, and it explains how to use it. You can also have your clients fill out this form, choosing a design. They can mail us a self-addressed stamped envelope, or again, they can call our expert call center counselors at the 800 number. If you are looking to receive NeedyMeds materials and drug discount cards in bulk, of course, you can reach out to us and we will mail them to you directly. That's a lot easier, and I'll give you that contact information a little bit down the line. So now let's say your client has the drug discount card. They want to know what pharmacy in their area accepts it. They simply scroll to the bottom of the drug discount card page, and all they have to do is type in the zip code of where they'd like to pick up that drug discount card. So I'm going to do one right here in Gloucester, Massachusetts, which is where NeedyMeds is based. And this is what the pharmacy results will yield. There are 10 miles within the zip code of where NeedyMeds is. And you can see it gives the name, address, and contact information of the pharmacy. What that means is that the pharmacy is contractually obligated to use the NeedyMeds drug, to accept the NeedyMeds drug discount card. Okay, so now your client has the drug discount card. They have the pharmacy list of who will accept it. All they need to do next is click on the drug pricing calculator, and they need 4 pieces of information here: the name of the drug, the quantity, the day supply, and the zip code of where their pharmacy is. And this will provide them with an estimated price of how much that drug will cost using the NeedyMeds drug discount card. I find that really helpful. Personally, I don't have a car, and the last thing I'm going to do is walk around from pharmacy to pharmacy with my drug discount card saying, "Hi, do you accept this? Hi, how much is it?" I can't do that. Nobody could do that. So you can either do it online, or again, our expert call center counselors can do that work for you. So let's again switch out of the live website back to the PowerPoint presentation, so I can drill down into specifically how you can help your patients or your clients get access to all these tools I just brought to your attention. I think one of the most crucial things is by simply being aware of NeedyMeds. Making sure you know our website address, www.needymeds.org, our toll-free helpline, 1-800-503-6897, making sure when they leave your office, for a prescription that they know if their insurance isn't covering it or they don't have insurance, that there is a place to turn. So being aware, referring them to NeedyMeds, those are really important tools to have in your back pocket. You can also schedule a staff training. And what I mean by that is if you would like your staff to learn more about NeedyMeds, or if you have a staff that can actually help people find what they need on the NeedyMeds website, shoot me an email, let me know, because I would be more than happy to scheduleize a personalized training for you and your staff at a date and time that is convenient for you. We also do monthly webinars that are just overview webinars going over more detail over the resources we have on our website. You can also sign up for NeedyMeds mailings. Now, certainly by that, of course, I mean we have our monthly newsletter, we have monthly webinar announcements that let you know what webinars are coming down the pike. But we also have email alerts. For example, if you want to be kept abreast of what new prescription assistance programs are coming out for Lipitor or any new prescription assistance programs that pop up or changes, you can sign up for what's called PAPIS, the Prescription Assistance Program Update Service. We do the same thing called DAPIS, Diagnosis-Based Assistance Program Updates. So anything that's new that may help your clients, you can be made aware of. I will switch to our website to show you how to sign up for those subscriptions. For those of you listening that do work with the staff that directly helps people find cost assistance programs, we also have a software called Pap Tracker. Now, I always say all of the resources and materials that we provide are free of charge. That's true, with the exception of Pap Tracker. Pap Tracker is a software that will help you and your team eliminate the administrative burden of manually applying for and tracking prescription assistance programs. If you're interested in learning more about that, if you'd like a free trial, if you want a demonstration, again, shoot me an email and let me know. One thing I want to stress, we are not selling that to you or trying to sell it to you. My goal is to make sure that if you have a staff that's taking up an inordinate amount of time helping people apply for and manually track prescription assistance programs, there is a way to eliminate that burden. Pap Tracker software is an example, but certainly just be aware that such software exists and go do some research. See what other programs are available, something that may work better for your need. Maybe there's something cheaper. So just check it out, but be aware that there's some administrative help out there for you. Another way you can help your patients by simply having NeedyMeds drug discount cards and educational materials on hand. And we can mail that to you. We mail our packets in quantities of 25 in both English and Spanish. We do have our materials available in different languages on our website as well, and those could be downloaded. But again, keeping those materials on hand to distribute to help your clients and patients can really go a long way. And I think I saved the best for last, which is by providing your clients or patients with the co-branded drug discount card. So what that means is, let me just escape out of here so I can show you what I'm referring to. So now, here's the NeedyMeds drug discount card page. Now, if we mail out a drug discount card, it'll be one of these 4 designs. Some of them say NeedyMeds on it, and some of them simply are generic and say the card. We can instead put your organization's name and logo. We can also assign it its own, and forgive me, I don't remember if it's group number. I think it's group number. We can assign your own group number. As I said, our card is not only free, but it's anonymous. We don't track who's using the card. We just track the dollar amount of savings and the number of times the card is used. So what we can do is we could put your organization's name and logo on the card. We can assign it its own group number. We can mail those to you free of charge. And every month we can let you know how many times your drug discount card was used and the dollar amount of savings. And again, that is free of charge. That's a great way to market your organization, but more importantly, it's a great way to make sure your clients are walking out that door with a safety net. And it's a great metric for you to track how many times your drug discount card is used and the dollar amount of savings. One quick little disclaimer I will say, it is absolutely free of charge unless you need it printed in color. All of our drug discount cards, co-branded drug discount cards, we print in black and white simply because we're a nonprofit and we can't absorb that cost. If it's important for you for branding or marketing purposes, which it may be, to have your card in color with your name and logo in color, as I said, that will be a fee, but we're not making money off of that fee. We're just passing along, absorbing the cost of that color printing to you. So that's a really great option to, again, help your clients and help spread the word about the good work you are doing for them and their families. I also talked a lot about subscriptions. Under the Advocates tab, there's a whole bunch of other information for you and your team with not only how to stay up to date with NeedyMeds, but other healthcare topics. On the left-hand side, you'll find a whole category for resources. And here's where you can sign up subscription services. You can sign up for our PAPIS and DAPIS weekly or daily email alerts. Here's where you can sign up for our webinars, and here's where you can sign up for our updates. Under that Advocates tab, you can also order print materials by going about it the same way. And let's see, what else did I want to mention? Oh, and under here is also more information about Pap Tracker. So check out the Advocates tab to see if you're interested in signing up for any of our email alerts or subscription services. So bear with me again while I exit out of the NeedyMeds website and return to our PowerPoint presentation. Up there, I wanted to put, we always ask for feedback. If you do have a moment out of your day, we'd love for you to visit the Great Nonprofits website and let us know what you think about NeedyMeds. You can drop me an email anytime. My email is simply my name, Carla@NeedyMeds.org. And I put my colleague Alana's contact information there as well, because if you're looking to order bulk supplies of drug discount cards or brochures, you can reach out to her. And of course, because I only said it about 18 times, so let me make it 19 times now, there's the NeedyMeds toll-free helpline. And again, I do see some questions coming in. And I encourage you to go ahead and submit any questions you may have. So one of the questions, again, was emailing the slides after the presentation. I will go ahead and do that. I was hoping to go ahead and upload that into the handouts section, but it doesn't look like I'm going to be able to do that. So I will be happy to email the audience who's interested. Shoot me an email if you'd like to receive a slide of this PowerPoint presentation. Let's see. I have a question coming in specifically about prescription assistance programs. This individual has found that certain prescription assistance programs don't allow participation for members with insurance coverage. But sometimes if they talk to their doctors, they can get their patients into the very programs. Have I encountered this? So I can say very quickly and candidly, I have not encountered this, only because I'm not an expert working in our call center section. What I can say is, one of the things you point out is absolutely true. There are a lot of prescription assistance programs that the eligibility requirements means that they cannot have insurance coverage. What may be possible is when you talk about their doctors getting into the programs anyway, what you can do, and again, this may be what you're referring to, let's say you have a prescription assistance program and the person is not eligible. Maybe they fell a little bit above the eligibility guidelines when it comes to income, or maybe they do have drug coverage. Believe it or not, you can call that program that's supporting the prescription assistance program and ask the program to make what is called an economic hardship exception. They may do that. It's absolutely worth the call. So let's say you don't get anywhere with that. You try and call, and then you appeal, and you don't get anywhere with that. What you can do then is, instead of calling the program, you can call the pharmaceutical company directly and ask them to make an economic hardship exception. So that may be what is going on when they talk to their doctors and somehow the doctors gets them into the program. That's really the only thing I can think of. But I'm really glad you brought that up, because it's an important point that if you don't specifically qualify for a prescription assistance program, there are a couple of calls you can make to advocate for yourself to see if that's an exception can be made. Oh, another really great question. Do we feel that the eligibility requirements we had listed specifically for the prescription assistance programs are up to date? I would say yes, they are up to date. We have a team of 2, it might be 3, but full-time employees. That's all they do. They dedicate themselves to making sure the prescription assistance programs are accurate and up to date. With that being said, it could never hurt. We will give you the phone number to that prescription assistance program ourselves, and always err on the side of caution to confirm the information we have on our website. Certainly, we would love it if you were generous enough to give us a call or shoot me an email to let us know that there is misinformation on our website, because no matter how proud we are, we're human, and could something slip through the cracks? Absolutely. So err on the side of caution and give that prescription assistance program a call if you do have the time. So here's another great question. We have an audience member that joined a little bit late, asking whether or not this was primarily for patients in Florida. And actually, I know as she listened, she got the answer to that. But I'm actually glad you did ask that. So thank you, because NeedyMeds is national, meaning all of these assistance programs and the free and anonymous help we can connect you to is available for anybody that resides in our country. So let's see, does being in the coverage gap mean not having insurance coverage? So that's a great question. It does not always. Some people do have insurance, but they fall into like a coverage gap, like the Medicare Part D donut hole, where maybe for a particular time they're not covered, or a particular medication isn't covered. So it's not exactly the same as not having insurance. It may feel that way to your wallet, but it's not exactly the same. Oh, so we've got great questions on what's the scoop on getting prescription discounts for animals. When we talk about using the NeedyMeds drug discount cards to save on pets, we're primarily talking about cats and dogs. And I would be happy to email anybody that's interested a hyperlink to our less than 10-minute video that explains how you can go ahead and do that. Here's a great mention from another audience member saying that an agent in one of the prescription assistance programs advised a counselor that when many clients are initially declined for the program, but that they should appeal, because many people that are declined, many times when the application is declined, it's reversed on appeal. So again, another great point by an audience member. Being an advocate for yourself, we cannot stress enough. So as I had said, sometimes when you apply to a prescription assistance program, you're denied, the appeal is denied, or let's say there is not a prescription assistance program available. Call the manufacturing pharmaceutical company and ask them to offer you a discounted price. So that's a great point. If you get a no, try back through appeal by calling the pharmaceutical company. And again, I understand that completing prescription assistance programs can be a bit complicated, but certainly if you've gone through the trouble to do it and you're in it already and somebody gives you a quick no, it's absolutely worth appealing. Let's see if we have any other questions coming in. Yes, I will be happy to send everybody who's asked copies of the PowerPoint slide. So we have a question coming in about copays. Let's say if a patient has a copay of $150 for a monthly prescription, that person may be able to qualify for an assistance program because that copay is so high, and that's absolutely accurate. We do have copay cards that will help with that. So there is a difference between a high copay or high deductible. The copay is exactly that, what you pay to obtain the drug or the visit. It's what you pay in that moment. And a deductible is essentially what you pay every year just to have insurance. But I do think the question is, what is considered a high copay or deductible? And I hate giving this answer, but it's the only one I can do. Defining what's high will vary from program to program. So let's see. Unfortunately, although I do not have a summary of notes, this presentation is being recorded and it will be converted into a YouTube video to be added to the NeedyMeds YouTube page. And let me show you where that is before I wrap up for today. So at the top, we have all of these social media platform hyperlinks: Facebook, Twitter. This red button is our YouTube channel. We are actually working really hard to update the NeedyMeds YouTube channel, but hopefully that won't affect you. These are most of our previous webinars and special topic webinars. And here's the webinar I was talking about using the NeedyMeds drug discount card to save on pet meds. Of course, I'll email that to those of you that have expressed interest. But I recommend checking out the NeedyMeds YouTube channel and even subscribing, which is the top right-hand button. Heads up that we're working to update this and convert it to a new page. So if you subscribe now, you may have to subscribe a little bit later, but it's a click of the mouse. I hope it's not that big of an inconvenience, but this is really a great source of information. As you can see, there's tons of information, not only about NeedyMeds, but other important healthcare topics. So as promised, I want to switch out of this and go ahead and leave you with the contact information for myself and NeedyMeds. And if you're like me and you think of all the questions that all of the questions come to you once the webinar is over, don't hesitate to reach out to us or me personally if you have additional questions. Thank you so much for your time. We do hope you join us for future special topic webinars, and we do hope you stay in touch. Thanks so much. Take care.